as long as I am breathing, I will always, always worship you. Here's my worship, all of my worship. Receive my worship, all of my worship. Here's my worship, all of my worship. Father, receive my worship, all of my worship. Here's my worship, all of my worship. This morning, Lord, receive my worship, Lord, all of my worship. And I will not be silent. Hey, I will always, always worship you, Lord. As long as I am breathing, I am breathing, Lord, I will always worship you. Here's my worship, all of my worship. Receive my worship, Lord, all of my worship. Mitiasia, mitimao, semi wonswa, mi womao, akweni nemo, mia 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 uti, mitiasia. Timao akwenemo mieuti mitiasia mitimao mitiasia mitimao sami woswa and if I live for you, and if I die for you, oh Lord, in all my ways, I'm ever, ever, ever yours. If I die for you, oh Lord, in all of my ways, I'm ever, ever yours. If I die for you. In all my ways, I'm ever, ever yours. If I live for you. So I will worship you forever, love you forever, because this God is too good. Oh, I will worship you forever. I
welcome to Breakfast Daily on City TV. My name is Jifa Amatam.
Good morning, and my name is David Kwekusechi.
And of course, that was Ni Abe.
Yes.
It was recorded earlier when he joined us for Breakfast Daily, but it's an interactive show. So wherever you're watching us from, don't forget to use the hashtag Breakfast Daily.
Yes, and the WhatsApp line is +233 550 We would like to hear from you for sure.
Definitely. And every morning we start the show off
with
a
the quote of the
So
day. Let's take a look at the quote for today. All right, so this quote says, "Hope is praying for rain, but faith is bringing an umbrella." Now, we tried looking for who made this quote, but we still can't find it. But it doesn't really matter. It's still a very powerful quote and very insightful for us. It says, "Hope is praying for rain, and faith is actually doing something about it." Yeah. Take an umbrella. You know, and prepare for the rain. The rain hasn't started, but you have an umbrella because you're expecting rain. So the difference between hope and faith.
Yeah.
You know,
and I think in this generation of coronavirus, hope is all of us thinking that we're going to get through this, we'll be fine. And faith is actually doing the things that are required to get you ahead of the curve, right? So washing your hands with running water and soap, you know, keeping a social distance. Using a face mask when you walk out of your house so that you are preparing, but you're still hopeful that things will get better. But by actually doing the things that are required, you'll be fine. Speaking of masks, all month of April, we are declaring a face mask month. Okay, what that means is the minute you step out of your house, you put on a face mask. It's not only to protect yourself, but also to protect others, because you might have the virus and you're not showing any symptoms. And because we can't all test each other, the least we can do is actively engage in preventive measures like putting on a face mask the minute you step out of your home. So get a face mask, put it on, and let us all be each other's keepers.
Absolutely. And let's take a look at where we are right now in terms of the fight against COVID-19 in Ghana. We are 195 cases so far counted. We have 5 deaths, 3 recoveries, and the current active cases is 187. So this is where we find ourselves so far. I believe that more numbers will be coming in soon as the testing begins more aggressively. And like the Minister of Information, the Health Minister said yesterday, there's going to be a massive ramping up of tests. You know, that's going to be happening. So I think it's important for us to bear in mind not to panic when we see the numbers going up, because there's a very deliberate attempt to make sure that as we test, we are actually picking away at the advance of the disease within the country. You know, it's important. And like I said, we shared with you yesterday, there are 2 ways of fighting this. You can fight it from on top or you can fight it from beneath. And the way of fighting it from on top, and I'm just using it as an analogy, is to literally enforce the social distancing, whether you're in a trotro, whether you're in a car, you know, which means that if you're in a car, you shouldn't be 4 in the car or 5 in the car. It shouldn't be. These are not normal times. Maximum 2-3 people in a saloon vehicle is enough. You know, if you start to go above those numbers, then you're beginning to go against the social distancing advice, which means that you're going to put yourself in a precarious situation should anything untoward happen. All right, so it's important to maintain those measures: social distancing, keep your hands washed as often as possible, use alcohol-based sanitizers, especially if you don't have immediate access to soap and running water. But soap and running water is your primary means of keeping your hands clean and sanitized the entire day. All right, it's important to do that. Then, of course, the government is also attacking it from beneath, which is now the testing, exposing who is ill, who has been in contact with somebody that is ill, and so on. And all of this makes sure that
Definitely, and today is officially the 4th day of the partial lockdown. We've heard stories of soldiers brutalizing people, but one man is showing us the way it's done. He's showing us that it's possible to educate the general public and not use force. I'm talking about Lieutenant Colonel Kwame Nfum. We have a video of him with passengers in the trotro doing what every other security personnel should be doing in the country. So we take a look at that and then celebrate the man.
But it's better than losing your lives. Do you understand? It is better than losing your lives. Go through the hardships in your house. It is better than you live in this world. Your maker up there has a purpose for you. So please stay home. I hope you understand what I'm saying. Make it very easy for everybody. Just we all have our families. We would have been happy staying with our families back home. But we are out here working for God and country. And then for you. So please stay home.
So that's a commanding officer of the 48th Engineers Regiment at the Ghana Armed Forces, not using his gun, not using his fist, not intimidating people, but using his humanitarian drive to actually educate people, using the emotional intelligence we talk about every day to say, perhaps these guys don't understand the magnitude of what we are dealing with. Let me take this opportunity to actually educate them. Let me use this chance to help them appreciate the importance of staying home. And this video has gone viral for all the right reasons.
Yeah.
He could have decided to intimidate them. He could have decided to use force. He could have decided to be the macho man around them, but he didn't. And that is commendable. We are celebrating him. If you know him, thank him on behalf of the entire country. We're grateful for the work that he's doing, and we hope that all of our security personnel will learn from him and know that sometimes educating people is all you need to do to achieve whatever objective you're out there to achieve.
Yeah, and it's very important, I think, for somebody at his level. He's a lieutenant colonel. He is a commanding officer of one of the most important engineering units that we have in this country. And to see him exhibit such grace, you know, in a moment where people are afraid, where people are not sure what's going on, you know, to use his position and his authority with such grace, it's just amazing to see, you know. And like Jeffa said, we can't. I would say that, look, we can't overstate this. This is what everyone should be doing. All the police and all the military men out there today take a cue from his example. And this is what we need to be doing. Yeah.
Now, every Thursday, we spend quality time with a health professional, well, actually all professionals, to learn a bit more about the work that they are doing and how we can take up from the skills they apply to their work, the commitment to their work. And today we'll be talking to a lab.
Yes, a lab scientist, medical lab scientist.
Wow.
And Mr. Amenya is here with us. Good morning, how are you?
Good morning, I'm fine.
I love your shirt.
Thank you very much.
What is a lab scientist? What do you guys do?
Okay, a lab scientist is a healthcare detective.
Okay,
who uses the body fluids, body materials or cells from humans and then perform medical or scientific tests or research or analysis on them to come out with relevant data that is required for the diagnosis and treatment of patients. In that, the data we give further helps in the monitoring of treatment outcomes. So lab scientists, basically, that is what we do. We say that we are the oracles that is consulted in the health system. For instance, when you go to 1 Samuel chapter 9, verse 9, when the donkey of Saul's family was missing, they went looking for that. Then an idea came, let's go and see the seer. And then in that particular text, it says that in those days, when they go to inquire of the Lord, then it means that they are going to see the seer, who is now called a prophet. So the lab scientist is just like a prophet that has the ability to see what is wrong with a patient.
What sparked your interest in this field?
There are a lot of things that can easily move you into lab science, but what actually pushed me is the drive to contribute towards the care of people who are sick. In fact, when you see people sick or not well, I mean, sometimes you go to the hospital, you see people who are, I mean, I say, but when you see someone who is critically ill, and you are able to come out to say that this is not what is wrong with the person, but rather this, and based on the data or information you give, it leads to the cure of the person. It is much more gratifying or satisfying. So that is basically what pushed me into the field.
I mean, as a young man, did you always think this is what you were going to do?
Well, when I was in school, it wasn't. But, you know, as a science student, you are supposed to go to Science Resource Center. And usually, I went to Chemu Secondary School. Okay. So we go to Tema Secondary School for us to do our practicals. I've always find myself bullying people around the microscope. Yeah, and when I come back and I'm studying, I see myself reading stuff that are way ahead. Later, when I went to the tertiary institution, I realized that that is what medical lab scientists do. I saw myself reading about viruses, bacteria, some parasites that were way ahead of what we were reading.
What did you like about them?
Well, I think that what do I really like about them? In those days, I think the knowledge in the textbooks those days were structured in such a way that with me, I easily understand them, even though I was struggling with some few things in the science, biology, gas. But I don't know, maybe I'm built for that. Yes.
COVID-19.
Yes.
Do you ever... okay, so let's start from the beginning, COVID-19. Okay. How different is this from any other experience you've had in terms of viral, understanding viruses and all of that? How different is it?
Okay, so COVID-19, when you mention COVID-19, you are talking about coronaviruses. Yes. Usually, we have different fields in the med lab. It pushes you to the microbiology branch of medical laboratory, and there's another subfield which we call virology. Okay, so virology is just a study of viruses. So there are a lot of viruses we have interacted with, I mean, theoretically, scientifically. So, I mean, way back where our attention was on HIV, then we came to the SARS virus, then we came to Ebola, which some of us think it is more deadly than COVID-19. But what is so peculiar about COVID-19? The peculiarity of COVID-19 has to do with the speed at which it spreads among people. And because it's new, most of the methods that we use to detect viruses, like we use tissue culture, we use embryonated egg, we use immunological assays to detect them. Now, we are pushed straight to the use of the real-time PCR for detecting them. Reason is because...
What is PCR?
I mean, actually, I've been hearing that a lot.
Okay, PCR is a scientific method that takes a DNA, denatures the DNA, and in the process, we have specific items we call primers that are put together, and it's like you restructure the DNA to the point where what you are looking for within a particular substance, you can see them. Then the final process involves you elongating them or multiplying them. So you pick just a little substance and you make it big, or you make a lot of copies out of it.
And what are you trying to achieve with that?
What we are trying to achieve in that is first of all, we want to see within the DNA strand, we are trying to see whether what is causing the problem, whether what we know to be the DNA of COVID-19 can be traced in a particular sample or in a particle. So we want to know whether Jifa is Jifa. So we have a certain knowledge of Jifa. So we pick a certain tissue, or probably you sit here, you put your hand on the glass here or the table, we swab it, we put it into a PCR test, and then we are able to look at certain molecules that we know is specific or has something to do with your molecular arrangement. Yes.
What's an average day like for you?
For a lab scientist?
Yes, especially a senior lab scientist.
Well, as a lab scientist, our primary duty is taking care of the patients. So we go early, and you have to make sure that your lab, your environment is clean. Clean in such a way that we always assume, even when you finish cleaning, we assume the bench, the item you are using can be infectious. So first of all, you make sure that your environment is clean. Then you...
So you're not only looking at the macro, you're also looking at the micro.
All of that.
Okay.
Now, then you try to set up. You set up your test tube, you set up your analyzers, your microscope, your tubes. Then you perform your controls, because if I say you are cycling positive, what is the proof that you are cycling positive? What's the proof that the reagent I prepared this morning worked? So we use a previous sample, known results, and then we run and make sure that it's showing what is expected. Then with our analyzers, we also ensure that we have samples that have been analyzed and standardized. It's not prepared by us.
Okay.
And we input the figures in the analyzers. So in the morning, when you come, you run your sample. When you run your sample, then you check whether the analyzer is giving you exactly or within a certain range what is imputed there. If it passed, then you know that each and every result you are coming out with is true, and it cannot fail unless something went wrong with the technique. So you perform your controls, you receive patients, you register them, you give them specific pathological numbers, which if this is Patrick, this particular number is associated with Patrick. So I am not seeing Patrick in the lab, but I am seeing a certain code which can be traced to Patrick. So we register the patient, we collect samples as per is required, then we subject them to analysis. After analyzing them, then we try to we analyze, we come back to the results. We look into the results to see whether it makes sense with what is expected. The doctor is querying. If it doesn't make sense, but your system is okay, you let it pass. And then you discharge your patient to see the, we call them clients. The doctors and the nurses we work with, they are clients, and the patients too are our clients.
I see.
Yes.
So how dangerous can it be to work as a lab scientist in terms of exposure to microbes?
Okay. When you have the right knowledge of what you are doing, then the issue of danger is halfway solved.
Okay.
So we are really exposed to microbes.
Yeah.
We are really exposed to microbes. In fact, it's in the health profession, just high risk danger of getting yourself infected. So very high, but that is where our knowledge of universal precautions, you make sure that, first of all, you are in the right protective clothing. You do what is expected. When we were in school, the first rule is you don't eat in the lab, you don't drink in the lab. This one is just basic.
But there are times you spend hours upon hours in the lab, right?
Yes.
So how do you still stick to that?
It's always a miracle, but
what makes a great lab scientist? Because you guys, the work you do, you're directly impacting the lives of patients, majority of whom you're probably never going to see. So what makes a great lab scientist from your perspective?
Okay, lab science itself is both a science and an art. A science in the sense that it involves scientific knowledge. So you need to have your knowledge of the basic sciences, medical sciences at your fingertips. So you need to be we say, with your knowledge of what you are dealing with. So there are certain basic courses which no matter what, before you can call yourself a lab scientist, you should know. For instance, you should have knowledge in anatomy and physiology. You have knowledge in microbiology with all its 4 branches, and there are sub-branches: pastology, cereoparasite, virology, bacteriology, mycology. Then you need to have knowledge of hematology, where you understand the various aspects of blood, the cells of the blood. We have the red blood cells, white blood cells, platelets. You need to know their normal cells, normal sizes, normal shape, normal colors, and then you need to know how they function in the normal sense and abnormal sense. You have further knowledge in chemical or clinical chemistry, where you know that this organ produces this substance, this enzyme, this hormone into the system. You know that at a certain point, this particular level of the hormone or that enzyme is supposed in the bloodstream. So if there is an elevation of that substance, then it tells you that.
Touch on the art as well, the art of being a lab scientist.
So it makes so with the art deals with the scale of the profession. You are supposed to pipette. Pipette is you pick 20 microliters of blood. So how do you pick 20 microliters and not pick 21? How do you pick 20 and not 19? Why? How do you pick 20 and not 20.5? So this is the artistic aspect. It's a skill, and that's from school. Usually when you are in school, you go for practicals, and there is a compulsory 1-year attachment where you acquire the skill of becoming. So you need to be up with your science and your arts.
I think we should come visit you in your lab and see how you do your work with such precision. And I love the passion with which you speak about your job. So thank you for doing the bit you can to make Ghana safe for all of us, Patrick. Thank you very much. Thank you at home for staying with us. We hope you've learned something, right? The most important thing is to be passionate about your work, understand the science of it, but also don't lose sight of the art of it. He doesn't engage his patients. He probably doesn't even know them by face, but he still applies the same diligence and attention to the work that he does to make sure that his patients are safe.
Absolutely. Well, thank you very much for watching this segment of the show. We're coming back with the news review segment. My name is David Krikusechi.
And I am Jifa Matam. Don't go anywhere. We'll be right back.
Agriculture is the backbone of Ghana. For the prosperity of the Ghanaian economy, it is imperative for the youth to develop interest in agriculture. The Living Fields Agri Challenge provides the opportunity to train and develop the next top agribusiness entrepreneurs. For this maiden edition, we have 12 contestants, 4 production groups. Economic viable and market-oriented vegetables will be cultivated. At least 4 agribusiness startups. Over 300,000 Ghana cedis worth of amazing prizes to be won at the end of the Agri Challenge. Living Fields Agri Challenge is proudly sponsored by media partners, powered by PB Studios.
Living Fields Agri Challenge, every Thursday at 7:30 p.m. only on City TV.
Welcome back. It's Breakfast Daily on CCTV. Thank you so much for staying with us. We'll take a look at our newspaper headlines, then some online stories, then introduce our guest who's already seated with us. But don't forget, the entire month of April is our face mask month. So as you're stepping out of your homes to go buy your groceries or whatever it is you may need to do outside, put on a face mask so that you don't transfer the virus to someone else or, get it from someone if they have it. So our first newspaper is the Daily Graphic. On the front page of the Daily Graphic, we have President households test negative for COVID-19. That story is on page 3. Parliament approves $35 million World Bank facility for COVID-19. We'll be taking a look at that story shortly, and it's on page 13. APSA Hollard give to COVID-19 fund. That story is on page 20. And finally, minimizing COVID-19 impact. Government rescues vulnerable. Kayaye to get meals, accommodation, stipends. That story is on page 3. And I think it's a very good one for all the vulnerable people in our society. We'll now take a look at the Ghanaian Times. President, First Lady, others test negative for COVID-19. That story is on page 12. 40 COVID-19 contacts quarantined in Tamale. That story is on page 3. Ghana's COVID-19 cases jumped to 195. That story is on page 14. And finally, COVID-19 update. Private burials increase in Accra due to ban on large funerals and lockdown. That story is on page 13 of the Ghanaian Times. We'll now take a look at the new crusading guide. Akufo-Addo test negative for COVID-19. That story is on page 3. COVID-19 panic at Spintex. Residents agitate over TT of Face Isolation Center. That story is on page 3 as well. Will ensure COVID-19 free Ghana, George Anders says. Donates hospital equipment materials to fight the virus. We're going to take a look at our final newspaper and then move on to some online stories. I'm talking about the ABC News. Dr. Bawumia launches online scholarship application system. That story is on page 5. John Mahama exposed in Airbus saga as special prosecutor moves into action. That story is on page 3. And there's an editorial here that says COVID-19 can't drown Airbus scandal. That story is on page 5. Finally, wicked rumors fall flat as President Akufo-Addo aides test negative for COVID-19. And that story is on page 3 of the ABC News. We'll now take a look at some online stories, starting with citynewsroom.com. On citynewsroom.com, we have coronavirus. Nigerians get cash welfare payments during lockdown. Coronavirus response. Parliament approves $35 million facility from World Bank. COVID-19, Health Minister misspoke on treatment of VIPs at BOG Hospital. It's coming from the Information Minister, Kojo Pon Nkrumah. July's budget will realign economy to global COVID-19 impact. That's coming from the Finance Minister. Cutting down ministers, staffers for coronavirus alleviation program immaterials, coming from Oforiatta again. We'll now take a look at some business news from citybusinessnews.com. Don't touch Heritage Fund. You'll burden future generations. IES cautions government. Government engages telcos to reduce cost of data over COVID-19 impact. Finance Committee yet to decide on request for lowering of stabilization fund cap. ADB to support agribusinesses and farmers to mitigate COVID-19 impact. AGI to aid identification of members in SME sector exempted from partial lockdown. When I take a look at some more local news from myjoyonline.com, Burkina Faso, Guinea refused to receive citizens who tested positive for coronavirus in Ghana. It's a really interesting story there. When I take a look at some global news from bbcnews.com, Africa Live, Rwanda's coronavirus lockdown extended. UK concerns over testing as global cases near 1 million. Of course, you can get all of your news from citynewsroom.com and all of your business news from citybusinessnews.com. Now, throughout the news review, we want to hear from you. So wherever you're watching us from, the hashtag is Breakfast Daily. And if you want to reach us directly, our WhatsApp line is 0550-585-832. If you're outside Ghana, the country code is +233. I have been joined by Dr. Kwabena Chum Nyama, who's the chairman of the Health Committee of Parliament and MP for Burikum East. Good morning.
Good morning.
How are you?
I'm doing well.
Thank you so much for being with us.
Thank you for having me.
So today will be a one-on-one affair. I hope it's okay.
Yes,
we're focusing solely on the health sector.
That's okay.
Perfect. So I'll take my first story from the Daily Graphic. I'm reading from page 13, and it says here, Parliament approves $35 million World Bank facility for COVID-19. So Parliament has unanimously approved $35 million financing agreement for Ghana's COVID-19 emergency preparedness and response project. We're going to break down what the chairman of the Finance Committee, Dr. Mark Asibe Yeboah, said about how we're going to actually spend this $35 million. So the first one is broken down to 4 parts. He said 21.5 million would be earmarked for component 1 of the project, which involves case detection, confirmation, contact tracing, recording and reporting, containment, isolation and treatment, as well as social and financial support for household and the health system strengthening. So we're going to take all of these 4 cases one by one so that our viewers would have a better appreciation for them all. I'll quote Dr. Asibe Yeboah briefly. He says that this fund would actually strengthen the national capacity for laboratory surveillance and diagnosis, case management, contact tracing, and infection prevention and control. It will ensure minimum health logistics are in place in prioritized regions, health facilities, and points of entry for preparedness and laboratory capacity sustained for timely and quality testing of COVID-19 samples. So the breakdown again, the first point will be $21.5 million, and it will go towards case detection, confirmation, contact tracing, recording and reporting, containment, isolation and treatment, as well as social and financial support for households. So my first question is, where do we stand with addressing these issues for case 1? What's our potential right now versus where we should be, and how will this fund help us get to where we need to be?
Thank you very much. I think when the president, first of all, told the nation that he's devoting $100 million to support this coronavirus strategy in Ghana, it encompassed all these strategies. And since this pandemic is an ongoing, if you like, event, most of the strategies are also reviewed daily. So it's not like it is now that we're going to start implementation. Most of these things have already started, and these funds are just coming in to support. There was a broad plan and the total budget is $100 million, and you need sources of funds to come in to make up for the whole $100 million US. And if you see, this one is $35 million US. Mm-hmm. And if you, let's say, take the first component of the broad heading, you realize that it included case detection, mm-hmm. it included treatment, it included isolation. And we have already started doing those things. The fact that we can say we have 195 cases in Ghana now means we were able to, first of all, identify the cases, then we were able to test the cases, and then afterwards we've isolated some of them have been treated and they have recovered. So we have already started implementing some of these, and the $10 million is for all the things we're going to do as far as COVID-19 is concerned, from day one up to whatever date, until a review of the budget is done.
Okay.
So it is not like normally you have to approve the loan before the implementation or let's say utilizing the facility begins. Mm-hmm. But this one, we've already started even spending the money. Mm-hmm. That's how come when the finance minister came to Parliament, I think last week, he said we've already mm-hmm. and you make your projections. Mm-hmm. Once you buy an amount from an area to go and spend, mm-hmm. you always have to plug that hole. Mm-hmm. So this amount facility, if you like, is coming in to plug the hole which has been created by this COVID-19 purposely for treating, or let's say the interventions towards treatment of cases. We know that there's a far-reaching effect of COVID-19 on the economy, which will also be handled. That is how come issues about the stabilization fund and all that are coming in. But that is a bigger picture. This one is just purposely for issues relating to case detection, treatment, isolation, education. That's what they call the communication risk. People educate the public, billboards, commercials, all those things are part of the strategies being rolled out by the government against this COVID-19, and all have been budgeted for in this bigger intervention, and all of them will make up mm-hmm. for the $100 million US. So this facility is part of the total budget which the government has already told the people of Ghana.
Okay.
So after the $35 million,
now, do you have an idea of where we are as far as our potential to test people? Because we know that right now the number is 195, right? So realistically, I mean, we already know what it is on paper, but breaking it down to our communities, where do we stand, and how will this drastically transform our ability to prepare and fight coronavirus?
As I said earlier, most of the interventions keep changing based on the information we receive and where we get to as far as your case levels are concerned.
Okay.
Initially, when we started, they were only screening people mm-hmm. at the entry points, mm-hmm. and then later on, the intervention changed. Mm-hmm. We said those who come from countries with 200 and higher cases, when you get to the airport, you'll be quarantined, and then afterwards, we even said we are not taking any more flights into the country.
For 2 weeks.
Now we've had an enhanced testing where all the contacts are not monitored. Mm-hmm. Once they get a contact in the lockdown areas, once they get a contact, you are tested immediately. Mm-hmm. So we have enhanced the testing. It is not up to what people will call mass testing. Mm-hmm. But based on the number of cases you keep churning out, mm-hmm. you need to modify your strategy. Okay. So all in trying to improve our case detection strategies, we've now moved to the enhanced testing phenomenon where the moment we identify a contact, we don't monitor you, we immediately test you. Okay. Initially, we had only 2 testing sites mm-hmm. at Noguchi in Accra, and then cases here. Now they've added the public health reference lab in Kolebu. Mm-hmm. Navrongo is being put on. They want to add another center at INHO, okay. University of Health and Allied Sciences. The intention is to improve the testing sites based on the strategy as and when we rolled most of the interventions out. In addition to the testing sites, we are also increasing the number of treatment centers. Initially, we had Rage, Tema, and then they added Kolebu. Now, every region has at least 2 treatment sites.
Okay.
I think the minister 2 days ago spoke about the use of the Bank of Ghana Hospital as a treatment center. The University of Ghana Medical Center has also been added, and then the new hospital that was opened in Medina, the East Municipal Hospital, has also been added. So we are trying to increase the centers as and when the need arises, so that we don't just, misuse, if you like, the resource.
Okay.
So there's an overarching plan, but based on where we are, an intervention is rolled out so that we always keep up with the pace of the disease.
Excellent. So let's take a look at the remaining 3. So component 2 involves strengthening of multi-sector national institutions and platforms for policy development and coordination of prevention and preparedness using a One Health approach. What does that mean? And we're spending $3.4 million on that.
Yes, the plan is not to limit all the resources we're going to expend under this COVID-19 intervention just for COVID-19.
Okay, so
the
looking
plan
beyond
is to look beyond COVID-19, as the President said, so that it will form part of a broader plan of the country in improving our emergency preparedness, so that even if you don't have another COVID, whatever condition will come in future. We had Ebola in 2014-2015. Now we have COVID-19. I'm sure what we did at that time might have assisted us in our interventions currently. But the plan is to get some long-standing, plans and infrastructure put up. So we're going to roll out, build a lot of infrastructure in emergency preparedness, and they will all be there permanently, so that anytime we have any condition that requires any form of intervention similar to this one, we wouldn't need to go to ground zero and start coming up.
But what does it mean when you say multi? What does that?
Looking at COVID-19, we've realized that it cuts across the ministries. We have economic impact. Our hotels are also suffering, local government, our markets, and all that. So the plan is to try and coordinate these interventions so that every ministry will form part. It will not look like it's an isolated condition for only the health sector, but all the other sectors which actually have impact on our health. For instance, sanitation and all that, how we arrange our markets so that in future we wouldn't need to now be locking people down just because the way we've been positioning our markets do not even allow people to patronize it without compromising on some of the preventive measures that we have been talking about.
Definitely.
So the plan is to position all the sectors in such a way that whenever we have any future unforeseen circumstances like this one, the country will not be so much, taken aback, and then we will have to start doing everything from ground zero.
Okay, so case 3, of course, is $7.4 million used for community engagement. So that's the market stuff that you mentioned, and risk communication. What does that necessarily? Because we always talk about sanitation. We know what the risks are, but what more would we do now that we've not done in the past?
Well, the plan is to educate people to implement all those preventive measures.
Okay.
We know that there's no way we can keep up with the paces if we get more infections. So the first plan is to educate people so that we will undertake some lifestyle changes that will not even enable us to get the infections in the first place. So issues like social distancing, use of face masks, as you indicated, when to use, when not to use, not touching your faces. Those simple things we've been informed earlier, hand washing, use of hand sanitizers, not getting into the public when you have these conditions, calling some hotlines when you need help, and all those things. These are the things that we think, when people understand and implement, will help lower our rate of infection, so that the few cases that will come in, our health infrastructure will be able to deal with them without being overwhelmed like we've seen in other places. So that is what will be done continuously. And you also we should understand that this is a new condition. Even for the health professionals, not all were really abreast with this condition. So we needed to educate all of them so that they can also in turn educate the members of the public. And all those issues are part of this broader heading of community engagement, communication risk. So that is how come we have all that. And as you already know, these have started, a long time ago, but they are all part of the budget that we considered in Parliament yesterday.
Okay, so $35 million, finally, Parliament has approved it. It's part of the $100 million that we're raising to fight coronavirus. And of course, if you guys have any questions about what we are discussing, let us know. The hashtag is Breakfast Daily, and the WhatsApp line is 0550-585-832. If you're outside Ghana, the country code is +233. Throughout the news review today, we're just looking at the health sector, right, where it is currently, where it should be, and how we're going to properly position it to fight coronavirus. This time last month, we had not even recorded any case of coronavirus in Ghana, but now we're dealing with 195 cases. Certain communities have been identified as potential hotspots that we will start with the testing. We're getting more PPEs for our health workers. We've instituted a partial lockdown in Accra, Tema, Kaswa, and Kumasi. What more should we be doing to stay ahead of the curve?
I think if you realize the strategy has always been scaling up on most of the interventions that we all know. So we've gone to lockdown of the, if you like, the bigger areas. So the plan is to assess, to see the success of what we are doing. If we get to a stage where we realize that the curve, as we all know, is flattening, there may not be the need to augment these measures. But I obviously know that if after the 2 weeks we don't see serious improvement, then there will be no need to reverse. It may even be the need to rather, if you like, extend to other areas. You realize that we didn't even have a case from the eastern region, but now we have one case from eastern region. So it's like it started in Greater Accra, it moved to Ashanti region, we got one in Upper West, and then we had our colleagues from Guinea bringing some cases to Northern region, which is something that maybe you can say is a one-off thing, but it has moved from Greater Accra. We've now gotten a case in Eastern region. So it should tell us that if you like, the diameter is widening. So obviously the actors will be putting an eye on it. If we get to a stage where we need to add other regions, I believe it will be done. We all know the negative effects of these lockdowns. So in trying to also prevent this infection, you must also put your eye on the other issues of the state. That's how come you don't just ramp everything up together. You need to tailor it so that in trying to solve this condition, you don't create a bigger problem which will even be bigger than what you are trying to solve currently. So I believe it's on case-by-case basis, and at the right time, certain decisions will be taken. But we are hoping that with these measures, all of us will respect the restriction measures, and I'm sure, because if we are supposed to stay at home and not come out, as the president said, once you step out of your door, you should expect that you are putting yourself and your family in the hospital at risk. If you respect these measures, I believe we can easily flatten the curve and then come out of the woods very soon.
Okay, so we've done well with the preventive measures, as you mentioned, partial lockdown, bringing in PPEs, but we also know that if we look at other countries, there are going to be cases where people will require ICU beds, for instance. In a country of almost 30 million people, we only have 67, as the last time I checked. What are we doing to ensure that we are well equipped with the resources to fight coronavirus if perhaps 20% of the current number, 100, will need, or if that number will scale up in the coming months as we're testing, we are also well prepared to help our people fight the virus, those who will be tested positive and will need that type of intensive treatment?
Let me first of all say that realistically, as we've seen with even the bigger economies, once you keep getting more cases, obviously your infrastructure will be overwhelmed. That's how come the focus, if you like, has been hammering more on the preventive measures. But I also do know that even as we've started recording cases, obviously we also get cases which will get to the worst form that will need
How
ICU
are we prepared
service.
for that?
So I think yesterday the minister even mentioned some ICU centers that we do have. But the plan, part of the package, is to also improve on the infrastructure in some selected treatment centers to try and get some of the equipment which are needed to fight the worst form of the cases. And notable among them are ventilators. And, you know, part of the budget will be used to resource some of these. As I said, we've indicated they've earmarked some centers in all the country, in all the regions.
What number should we be targeting, right? Because, I mean, I've heard some experts say that we need at least 5 ICU beds per 100,000 people, right? So in a country of almost 30 million, that's about 1,500 ICU beds, right? So in worst case scenario, let's even assume we have 100. That's still not enough. So how are we preparing ourselves for this?
Obviously, we always have the optimal ratios for most of these indicators of health, like patient to doctor ratio, patient to nurse ratio. Those are the, if you like, the limits, targets that all of us aspire to based on our resource availability. And I don't think anybody will want to expect that within our limitations of resources we'll be able to get there.
Where would we be able to get to?
That will be our target.
Okay.
And as I said, for almost all the treatment centers, the plan is to have a minimum amount of ICUs.
Okay. Do you have an idea of the number?
Yes, each region, each center should have at least 5.
Okay.
But for the bigger ones, you know, already Korle Bu has a number, University of Ghana has already 10, which is quite big compared to the others that we do have. So the plan is to decentralize some of these centers, even though there are arrangements with ambulance service to move people from one area to the other. We don't want to be moving them repeatedly or rapidly. But obviously, when it gets to a stage where the case demands more specialist care, some centers will be more endowed than others. So then the ambulance service will come in to assist. But the plan is to equip almost all these centers with a minimum level of equipment, ventilators, at least 5, so that when you get these cases, you can easily start treatment based on what you have. And then if there's the need to augment from other centers, we can easily move across.
And if you say 5, does that mean 5 patients at a time?
Yes, because
so worst case scenario,
each patient will be on a ventilator at the worst case scenario.
So each region will just be able to take care of 5 extreme patients at a time?
Each center. I said each region has at least 2 centers.
So let's say 10 patients at a time.
Yes, and that is the initial plan.
Okay.
And as we move on, if there is the need to add up to the number, that will obviously be done. But we do not want to lock up some of these capital in certain areas where a time will come that you may not even need them. So we review it on case-by-case basis, and then we try to make changes.
But we should also project, because we know from other people's experience that we may get there in as much as we are preparing. So have we projected well from your experience?
The projection is where we are currently.
Okay.
But it doesn't mean we will definitely get there. We may even go beyond that, so we may have to even add to the number that we've stated.
Okay.
We can also not get there, but then that will be what we're working with currently. But then as I should add that there's always room for modification based on what is happening currently on the ground.
Thank you very much, Dr. Kwabena Atwum-Nyaama. He's the chairman of the Health Committee of Parliament and MP for Berekum East. And this entire news review will focus on the health sector, because as it stands now, we have 195 positive cases. 5 people have died, 3 people have recovered, over 50 people are being monitored from home, right? And we know that being positive doesn't mean that it's a death sentence. You will get better over time, but it's important for us to not only look at our ability to beat coronavirus, but the health system as a whole, and how do we, re-innovate that system in a way that if another pandemic comes, we will be ready to fight it. And we're also covering the fumigation exercise in the northern region. Some of our correspondents are there, so we'll be crossing over.
And the number for Cactus Creek is 055-039-5007.
Welcome back. It's still Breakfast Daily on City TV. Thank you so much for staying with us. The show, again, is interactive. So wherever you're watching us from, we want to hear from you. If you have any questions for us or any comments, let us know with the hashtag Breakfast Daily. If you want to reach us directly, the WhatsApp line is 0550-585-832. If you're outside Ghana, the country code is +233. Now, before the break, I mentioned that we're covering the disinfection of markets in the northern region, and our correspondents are there, so they're going to let us know exactly what's going on. We know that we've been to the Greater Accra region, we've been to Kumasi, we've been to Sunyani, we've gone to the northeast, northwest, and now we are in the northern region. So my colleague Mohammed is going to tell us exactly where he is and what he's observing. Good morning, Mohammed.
Good morning.
How are you?
I'm doing well.
Good. Where are you and how long have you been there?
Yes, I am currently in Yendi, in the Yendi municipality of the northern region. I've been here since 6 a.m. this morning.
Okay. What did you observe when you got there at 6 a.m.?
What I observed was that the team that is doing the fumigation this morning, they were arriving in the morning, and currently all is set for the exercise to take on right now, please.
Did the market women stay home? No one came out to sell their tomatoes last minute before they go back?
Yes, no, but I went around the town and saw that there was people have complied with the directive. There's no one, not even a single person has come to, do any sales in town.
Okay.
The town is virtually deserted on the main road, or all sorts are closed.
Okay. How many markets are we disinfecting this morning in Yendi?
Yeah, in the Yendi municipality, they are doing 10 markets.
10 markets?
Yes, 10 markets within the municipality. But in Yendi town, all the major roads and stations, Yendi is a central on the Eastern Corridor route. So they have a number of stations to other places. So they are free all parts in Yendi here. Currently, let me tell you, the guy now has come to, inspect the thing before they depart, and he has expressed happiness about what is going on. He even donated 1,000 Ghana cedis to them to, take water while doing the exercise.
Wow. How are the people there feeling? Are they excited? Are they happy? What's their reaction?
Yes, people are so happy here, and in fact, the exercise is, the MP said, he believes that Yendi exercise will be the best in the region.
Wow. Okay. So, have they officially started spraying yet, or they are still preparing? Because you've been there since 6 and it's now 8:36.
They are just mounting their cars to depart to other places. There's those who are to do the spraying outside Yendi, they have already gone. But Yendi town is yet to start.
Okay, so we'll check back in with you as soon as they start so that you can give us some updates. Is that okay?
Yes.
Thank you very much, Mohammed Alabira from Yendi, and we'll be covering the entire northern region throughout the morning. Now we're still here with Dr. Chumnyama, understanding what's going on in the health sector. So far, he's helped us appreciate what the $35 million that Parliament approved will do for us as a nation as far as situation as well to fight coronavirus. Now we're going to look at the entire health ecosystem and what we are doing to actually position ourselves well beyond coronavirus to ensure that we're taking good care of our citizens. We're not just waiting until a pandemic hits before we position ourselves well to treat our citizens. If you have any questions for us throughout the conversation, the hashtag again is Breakfast Daily, and the WhatsApp line is 0550-585-832. If you're outside Ghana, the country code is +233. So the document we're looking at here is the commercial contract agreement between the government of the Republic of Ghana and the health projects CZSRO. So you tell us what all of that means. But the amount is 71,500,000 euros to execute the construction of 12 polyclinics in Ashanti region, Eastern region, Greater Accra, and Ahafo regions in Ghana. So I'll break down the locations of these polyclinics. In the Eastern region, we have Jumapo, we have Kwabing, we have Nkwatia, we have Edukrom, we have Achiase, we have, in the Ashanti region, we have Swame, Drobonso, Sabronum, and Manso Nkwanta, Tredie, Mim, and of course, Bong Katamanso is in the Ahafo. Mim is in Ahafo and Bong Katamanso is in the Greater Accra region. And this is actually going to go towards upgrading some of the facilities, ensuring that we've improved our health infrastructure in these specific sectors. So my first question is, why these specific regions for the polyclinics?
Yes, I think this is a continuation to some of the infrastructure that has happened in some regions. Earlier on, they've done some in Upper West region, the old Bunahafo region, and then Central region and Western region. So this basically was for Ashanti, Eastern, and then one in Ahafo, and then one in Greater Accra region.
Okay.
So the plan is to try and roll out this infrastructure in every part of the country. So they pick a particular region, they select areas based on, the professionals, what they advise based on population distribution, and then existing health infrastructure distribution, and then they come out with what needs to be put somewhere. These ones are 40-bed facilities. And then let me also add that these polyclinics, unlike the earlier ones, are, if you like, enhanced polyclinics. They are even like mini hospitals.
How so?
The earlier ones were 10-bed facilities.
Okay.
They didn't have theaters. But if you look at this one, I think the last page has the scope.
Okay, so we have the OPD,
Yes.
right? General consulting rooms, the dental consulting rooms, physiatric consulting rooms, ENT consulting and treatment rooms. The previous polyclinics didn't have all of these?
They have consulting rooms, but they were not as many as these ones.
And
then the bed capacity was only 10. These ones
40.
40 is only one. The one at MIM is a 30 bed.
Okay.
And then the others are all 40 bed. And then these ones have imaging centers. They have theaters, so they are able to do surgeries. And then the maternity is also well developed than the previous ones, with facilities for newborns, incubators, and all that. So it's like a mini hospital, if you like, but just that the bed capacity is lower than what we normally refer to as district hospitals.
How transformative would this be on the community level, as far as, a woman needs to give birth, you go to the current one, they don't even have an incubator. Put a human face to it first, so we understand how big of a deal this is.
I think as a country we need to be having more of this. Yesterday, when we were taking the commercial agreement, almost all the members of parliament in where these facilities are going had the opportunity to comment. So they gave us a picture of what is happening now in
the realities on the ground. What were some of the stories they shared?
Most of them are district capitals.
Okay.
And they should by now be having what we call district hospitals, like the ones when we look at the others, at Nkranza, for instance, it's a 100-bed facility. That should be the target.
The standard.
But obviously, because of financial challenges, you can't do all at the same time. And so you have a whole district with no hospital, is only health centers, so they can't do surgeries in such places. When mothers give birth and the babies need incubators, they don't have, so you need to move them to adjoining districts. A typical example is Achiase in the Eastern region. There used to be one district with Achim Swedru. It's split into two, Achiase, Achim Swedru. all of them do not have district hospitals, so they all have to go to Achimota. And Achiase is where we have our jungle training camp. Our soldiers is very popular. People come from all over the world, and when they have emergencies because of these challenges, they need to move almost all their emergency cases that they get at the training center to Achimota. So because of the distance, once you have these delays, you can easily have casualties and fatalities coming in. Maternal deaths will also come in because the main cause of maternal deaths are the popular 3 delays: delay in the community and also delay at the facility. And if the person needs a long time to get to a facility that has the capability to handle such cases, you are bound to have fatalities. So these are areas which will go a long way to transform, if you like, the health. Because for maternal kids, we always have babies, and then a percentage of all deliveries will have challenges, and that is where you need some of these endowed centers to handle such cases when you get, just like we are grappling with COVID-19. That is also a reality, and we need to have these centers in almost every hamlet. The plan is to have a hospital in each district, and obviously it's a challenge. We keep even creating more districts, so obviously the pace will always be affected by that.
But that's a great first step.
That should challenge us to do more, and I'm very happy because it has also increased the number of bed capacity that we have in the country, and then not centralizing all of them in the bigger cities is also very refreshing.
How important is it to focus on the community level when you're passing policies versus just looking at the macro level? And you have experience managing facilities like this before, so you can touch on this for us.
Seriously, we all know that a chunk of our people are in the community, and mostly even those their income levels are lower than those relatively in the cities, even though we also have urban poor. But if you take the absolute numbers, those in the countryside are higher. And it's well known that in Ghana, people who are less endowed financially suffer more health issues than the rich. Even we all know of the these non-communicable diseases like diabetes, hypertension, but those who have money, when they have them, they are able to manage them better than those who
they
do
even
not
know that they have it. Some people don't even know.
And so you have these people already handicapped financially, and then when they are sick, there is little or no quality health infrastructure to handle them, because the facilities are also no good. You can't attract the right caliber of health staff to go and work there, and so sometimes even some of the treatment they churn out are also questionable. We should all face facts. And so sometimes people are even forced to do things they have not been trained to do, because it's so pathetic. You get a patient who thinks you should do something, then you tell the person it is beyond me. They still think there's something you can do, and so it puts you, the health worker, in a very awkward situation. And I think that these facilities will really assist the people, and I'm hoping that as a country we will be very committed in doing more of this. We should have bigger facilities in bigger cities, so that at least when you have very complex conditions, you can refer them to such places. But we don't get a lot of these complex conditions. It is these minor ones that we do get a lot.
And people shouldn't be dying of the
we should not be dying from them.
In our communities.
Mothers should not be dying because they are giving birth. Giving birth is a big service to the state, because the biggest and most valuable resource for every state are the human beings, and it is our mothers who give us this resource, and so we don't need to punish them for assisting us in that regard.
Thank you very much. So beyond, you've talked a lot about the beds, but let's look at the other issues that the 12 polyclinics will be solving. Laundry service, and you will help us understand them more. So corpse storage, dental service, audiology service, sterilization service, emergency care service, electricity supply, water supply, medical oxygen supply. Why are all these important?
You know,
as far as our community polyclinics.
Most of these facilities, for instance, the oxygen, we always buy them in cylinders like the gas we use at home.
And you do it manually?
Yes, and there are times you can run out of these, and then we all know the effects.
What will happen?
People will die
because they can't breathe
oxygen,
on their own.
You only give patients who are seriously sick oxygen, because normally everybody will breathe. So once we give oxygen, it means you are really, really very sick. And if at that stage, without not being your fault, you can't get the oxygen, it's really bad.
How many of the current polyclinics have this medical oxygen supply? Do you have an idea?
These ones, as I said earlier, the earlier ones we built didn't have this.
So as it stands now, if someone goes into our community and they can't breathe on their own,
so what they do is they buy these cylinders and connect, and then they use the nasal catheters and give to the clients. But this one, they are going to, the gases will happen automatically at the center.
So you won't have a case of patients dying
not having oxygen, because you have the equipment that will be churning out your own oxygen. And we are improving as a country. We're trying to get to a stage where we can do the right things at the right time.
And we place premium on our human capital.
Yes, so it's really refreshing. If you look at the imaging, I think there's also a portion
this one?
Yes. You also spoke about the audiology.
Yes.
That is for,
touch on that for us.
For ENT.
Okay. How big of a deal is that?
Yes.
So audiology,
over the years,
dietetic, sterilization.
Yes. The audiology is for ear, basically. Over the years, they are only available at the regional hospitals.
So you would have to leave from your community.
And so, because of that, people with ear conditions may not even be picked.
Wow.
And the worst part is to have a child who can't hear properly. He sits in class, they teach, he can't hear properly, and so it will affect his or her performance.
Yeah.
But with these facilities, the officers there, we have ENT nurses who will obviously be at these centers. They will obviously use these things to assist them in diagnosing all these hearing challenges properly and, without any serious hitches. And because of that, they can also treat them properly.
Okay.
If you misdiagnose, you're going to mistreat. And these equipment are supposed to assist the providers to diagnose correctly and then obviously give correct treatment.
All right, now finally, wrap up for us. How will the construction of these 12 polyclinics improve our overall health ecosystem?
Yes, because we're decentralizing and everybody will be getting access, and it's not like we're going to discriminate based on your social standing. People will have the confidence that the state is capable of handling their health conditions, and that alone is a serious psychological, if you like, advantage for us. And then it will obviously also improve our health indicators positively. Maternal death will improve, neonatal deaths because of the incubators will obviously improve, and the fact that they are able to diagnose conditions properly at these lower levels will improve the diagnostic abilities of the doctors and the other specialists there.
Okay.
And then it will also improve our health outcomes eventually.
Okay, so let's talk about value for money a bit. So the bill for this 12 polyclinics is going to be over 71 million euros. Yesterday, the minority raised questions that it shouldn't cost more than $3 million. What's your response to that?
Yes, as from what I've indicated, what we had earlier on is nothing compared to this in terms of bed capacity and even what we're doing now. So you can't compare those two issues at the same time. But that doesn't mean any figure at all can be taken. So these, facilities, what they do is they do value for money audit. And then the results are submitted and then they will be added into the contract if there are savings.
Because sorry to cut you off, but if you're looking at general consulting room, dental consulting rooms, psychiatric consulting rooms, the oxygen stuff, won't 3 million per polyclinic be enough?
Even though I'm not an expert, but I believe from what I know, it will not be enough, because these ones you are not only building, you're also going to equip Okay. You know, sometimes we can even build a facility and then there are no equipment. Okay. You need to now buy. By these ones, they build, they equip, and after that there is a 2-year post-defect period where whatever the defects are identified, they were going to refix them without any charge. And then also they're going to train the staff who will be using them for 2 years. That is also very important because sometimes you put up very nice edifices, and because those who are using them do not have the training, we quickly run them down, and then we have to now go back to look for money to fix it. So this is a new paradigm shift. All the agreements that we did yesterday, there's a component of training and then also medical consumables. You realize that University of Ghana Medical Center, there was this challenge of startup capital, so we had to go for a second loan. These ones all have included some form of startup capital in terms of consumables and equipment to start the facility so that they can start from scratch without any hitches. And it's quite a very good initiative currently.
Okay, excellent. So we have some messages from you guys at home. I'll read them. Dr. Abedi from Kwadaso, aka police need. Okay, thank God Parliament has approved a $35 million facility from the World Bank for the emergency response effort of government against COVID-19. But it's too sad people won't learn. I will still plead with Ghanaians to observe the partial lockdown. Okay, it is for our own good. Okay, hey Ghana. Okay, he says hi to Reverend Samuel. Yesterday I was at Dome Market, and very surprising, the butcher markets were running shifts, and this must be encouraged in all markets and all traders. This is coming from Godwin in Kwabenya. Finally, sensitization of COVID-19 did not go well with Ghanaians. Sometimes I wonder why Ghanaians are not showing careful attitudes towards the health precautions. The security personnel should stop beating, harassing, molesting, and threatening people. They should instead send people to court than to be beating them. That is coming from Yao in Taifa. So our final story here has to do with Korle Bu. We are getting urology and nephrology center, and it's going to deal with, so I'm going to read that briefly. It says, contract agreement between government of the Republic of Ghana and, okay, please continue that for me. Vamed Engineering GmbH, thank you, Vamed Engineering GmbH of Austria for an amount of 38 million euros to execute the turnkey construction of a urology and nephrology center of excellence at the Korle Bu Teaching Hospital. What's a urology and nephrology center, and why do we need them in Korle Bu right now? And before you answer that, there's a statistics here that says the prevalence of prostate cancer in people older than 50 years is around 7% of the population. 260,000 cases of diabetes have been recorded, while 4 million is estimated to exist. So what does this have to do with urology and nephrology?
Yes, thank you. The urology center basically is to handle cases of prostate enlargement. So
that's men?
Yes, for men.
Okay.
Yes, so for people like us, when you are 40
over 50
years, from 40 up, you should start checking your PSA levels.
The exam that they do, the thing.
Yes, yes, the rectal examination.
Yeah, sorry to be so visual.
Okay, so and unfortunately in Ghana we didn't have any dedicated facility.
Really?
And let me add that I think sometime in 2007, 3 urologists in the country perished because of the fact that we have limited facility. They were doing outreach services, and so they moved from Korle Bu to Sunyani Regional Hospital, and then on their way back to Accra, they perished. And so the plan was to try and improve on these services so that we'll be able to reach out to more men who will need these services. And this center is going to be, as indicated, a center of excellence an ensued center with every facility that is needed.
How important is it? I mean, for
so
260,000 is a big number. 80,000 is a big number. Right? In a country
yes,
of 30 million,
yes.
is it still considered that's?
Well, obviously, it's a positive start. We will need another center, maybe in Kumasi, to try and handle
the other cases.
The other cases in the northern sector. But as we've started at Korle Bu, it's because these are specialized cases. Wherever they are, people will refer them to Korle Bu.
What impact will this have on the health sector?
We also have a lot of kidney conditions where people have kidney failures. And when you have kidney failure in a chronic form, you either do dialysis or you have to do kidney transplant. And we've already done some transplants. I think very recently, Korle Bu did 4 cases, which are all very successful. But these were done in makeshift centers, not dedicated areas for such conditions.
So in summary, what impact will this have?
This will improve on our fight against conditions like prostate enlargement, and also, more importantly, people with kidney failures. Dialysis centers are going to be improved. We have more centers in here. Currently, the CEO of Korle Bu said they have over 300 people on dialysis that come to Korle Bu for dialysis all over the country. And what they have is not enough. So you have to, put people on standby. In fact, for the prostate conditions, when we spoke, they said they had booked cases up to the end of 2020.
Wow.
And because of the COVID, that they now have to suspend all such elective cases, then they have to now move these 2020 cases to 2021.
Wow.
And imagine if you need such surgery to give you relief, you have to wait for more than a year. With this facility, you can do more of such cases. We have most of the professionals now, but because of lack of space, you can't do a lot of surgeries at the same time. This is going to assist us in that regard, and I believe all men in Ghana should be very happy. And of course, once men are happy, I think our women too will join us to be very happy that we have this facility to try and give us some relief when we need it. For the kidneys, is for unisex. Everybody, if even kids can even have
very important.
These conditions. So I think it is quite handy. A lot of our mothers who get complications in pregnancy, eclampsia, where their BPs go up, most of them end up with kidney problems. And this facility will come in to support them. So it's a very, I am very happy that we are doing this as a country. So all of us should embrace it, and we just have to make sure the right jobs are done to set up the
Thank you
for us
very much, Dr. Kwabena Nyama, for being with us and helping us understand exactly how our health sector is doing and what we are planning to do to position it well beyond COVID-19. Thank you for the work that
let me add, and let me say that we also putting up a 330 maternity block. I thought,
wow, yeah, because you're talking too much about the men, so it's good that the women also have something.
Just like the one we have in Komfanoche, this one is 330 beds.
Excellent. So maybe you come back and explain that to us next time. Thank you guys so much for staying with us as well. You see, we've been talking about COVID-19. A lot of people have been, kind of panicking because you look at our health sector right now and you're like, how are we going to deal with this? But the experts are working and we're going to be just fine. Now, we're still covering the fumigation exercise in the northern region. We spoke to our colleague Mohammed earlier, and we're going to be talking to our colleague Diana Ungwan, who's in Tamale. She's going to tell us exactly what's going on, where she is, how long she's been there, what she's observed. Good morning, Diana. How are you? Can you hear me? Okay, so as you're seeing there right now, that's Tamale. We're covering the northern region. We're going to clean out all the markets in the north, just as we did in Accra, just as we did in Kumasi, just as we did in Sunyani, and we also did in the northeast region and the upper east region yesterday and upper west as well. Diana, good morning.
Good morning.
How are you?
I'm good.
Thank you so much for being with us. Where are you now? What have you observed? How long have you been there?
So I'm currently in Tamale, the Central Business District. where the disinfection is currently ongoing. And it's taking place in the market, the bus terminals, the streets, and some institutions like the banks here in the metropolis. And all the shops along the streets and the markets are closed to pave way for the exercise. And so far, I can say the street is virtually empty. There's so much activity going on here. And earlier, the Northern Regional Minister came around, observed how the exercise is going, and then he advised the public that aside the disinfecting, they also have a responsibility, that is to observe personal hygiene. Because after this disinfecting, when the women come to market, they have to ensure the place is well kept. And all this is in the quest to, fight the spread of the coronavirus in the country.
How have people reacted to the exercise so far? Do you see any bystanders? What are they saying?
Yeah, I saw some of the business people around, those who have their shops along the street. I asked them why their shops are not open. They told me it's because of the exercise, and so they are complying to the exercise, and they're actually happy for the exercise.
Okay, so what time have the sprayers arrived? What time did they arrive, if they have, and what are you hearing from them?
I didn't get that.
Have the sprayers arrived yet? Because I'm not seeing any sprayers right now. The people who are coming to actually do the exercise itself.
Yes. The exercise started about an hour ago.
Okay.
And they didn't quite start early because they were arranging. They actually divided the team into four. Some are in Yengi, Bushegu, Solong, and others are in Tamale. And so the exercise didn't begin quite early. Aside that, there's no major challenge here. Everything is going on smoothly for now.
How many markets are we going to disinfect in Tamale?
So, if you know, after last 2 weeks, within the Tamale metropolis, they had a disinfected farm market in the metropolis. So today, the focus is not on only the market, but the streets, the institutions around. And so for the Tamale metropolis, we have the Ababu market, the Lamashebu, the Kuko market, and some other markets in the metropolis.
Okay, thank you so much, Diana. So we'll check in with you later to see how things are going as far as the disinfection exercise in the northern region. Okay, so we're going to ensure that all the markets in the north are clean. Thank you so much, Diana. And thank you at home for staying with us. This is still Breakfast Daily on City TV. The news review segment just ended, and we're still covering the fumigation disinfection exercise in the north. We'll be updating you throughout the program. But after this break, we're going to take a look at lockdown with Jess. So if you're home and you're feeling a little lazy because it's day 4, you've not been active, this is the time to perhaps grab your sporting gear, get the sneakers, get your stuff. You're going to learn some quick, health workouts to do while you're home. Don't go anywhere. We'll be right back.
There is nothing as hard as a diamond. For buildings with superior strength that withstand all weather conditions, Diamond Cement should be your preferred choice. Locate Diamond Cement nationwide with factories in Aflao, Takrady and Bupe. Diamond Cement, as hard as a diamond.
There is no promise we cannot keep. There is no commitment we cannot honor. There is no delivery we cannot guarantee. There is only one Bethel Logistics Company Limited, a licensed international freight forwarding and clearing agent, a trusted global brand with an extensive network for the movement of air freight and ocean freight worldwide. We are the trusted name for road freight into Western and Northern Africa. We are fully accredited by Ghana Customs and Excise. We cater for all your freight forwarding, customs clearing and forwarding, cross trades, inland transportation, internal cargo tracking systems, customer freight costing and consultancy, cold chain logistics management, logistics and warehousing, quality inspection, and much more. In Accra, Tema, and Takrady, we are always available to ensure easy movement of cargo countrywide. Call us on 0204 528 900 or 0244 707 859. Email info@bethellogistics.com. Locate us in Accra at North Ridge, adjacent Accra Girls High School, or in Tema at Community 4, or in Takrady on the second floor of the GCB building. Website bethellogistics.com. Bethlog, experts in shipping logistics.
Say I find space for what I treasure. I make time for what I want, and I choose my priorities. And Jesus, you're my number one. Jesus, you're my please leave. is the flow that makes me white as snow. No other fount I know, it is nothing but the blood of Jesus. Oh, precious is the flow that makes me white as snow. Nothing but the blood of Jesus. It is nothing but the blood of Jesus. Oh, nothing but the blood of Jesus. Nothing but the blood of Jesus. Nothing but the blood, nothing but the blood. It flows from Calvary, washes me whole and clean. It's nothing but the blood of Jesus. Oh, the blood makes me white as snow, as snow, as snow, as snow.
All right, welcome back, and we have a lot more things coming up for you. But before we do that, just a reminder that we are actually having the disinfection exercise going on in the northern part of the country. We've done the upper west, upper east, northeast. We also we're in the northern region right now. We just spoke to a correspondent from Yendi and so on. So we have Maxwell Sook standing by. Good morning, Maxwell. Good morning, Maxwell.
Good morning.
Yeah, how are you? Where are you, and what can you report for us?
Yeah, so at the moment I am just closer to Tolong, where the exercise is about to take place. The team have not arrived yet, as I'm told. They dispatched from Tamale, so the Tamale team is currently doing that in other places. So in Tolong, there are major markets around the popular market. There is serves the whole region, let me say that, because this is where many people come, and it's not that there are no structures built. There might just some pavilions that people have, so it's likely to be just within 1 hour work, and then they will have to move to another station. So this is at the moment the entire community has been blocked, all the shops. No one is operating at the moment, and I am told it is not only the market that the spraying will be taking place. It's equally going to take place in major roads and paths and where people gather always, like the stations and all that. So currently this is what, and the people have complied. Actually, they have stayed away and locked the shops where these things have been earmarked for the spraying. So from there also they will come back to Nyankala market. Nyankala is another bigger market that people come to trade, and this is currently the same people have stayed away, and we are waiting for the officials, the sprayers to come and do the work.
Just to give us a sense of the size of the operation today, how many markets are we looking at?
So in this region, there are roughly the same team will go to the Kumbulu area and in markets area that the team will take care of. Now, that same team will move into the Kumbulu district as well. And the Kumbulu district, there are about 3 markets there. We do not have a market in the Sandarugu municipality. The Sandarugu municipality has no market. I'll put that on record. And what they will use that there is just to spray houses and then some selected households and selected streets. This is what we are told from that assembly. So it's not the markets here are not that they're not that much compared to that of the other regions and other parts of the region. Let's say in Yendi, for instance, they have about 70 markets, but in the northern region and in this part of the region, there are just some few of them. These ones they attract a lot of people because you see people coming all the way from the northeast, all the way from Bonahafu, all the way from Eastern Corridor Park to come to this market. So it is a one that attracts a whole lot of people from different parts of the country.
All right. Thank you very much, Maxwell.
So if anything comes up, I will update you. Yeah. I'm sure they are arriving at time soon, so I will put an update on the platform right now.
Definitely. We'll be looking forward to hearing from you once the disinfection begins. Thank you very much for that, Maxwell. Thank you. All right, so as you can see, the operation is going on everywhere, all the different districts and towns. We're looking at the markets, especially making sure that these centers where people trade, these centers where people travel and commute to come to trade and go away back from are sanitized, disinfected, so that they don't carry diseases away and take them to their homes. So we have up next Lockdown with Jess. Take a look.
All right. Hello there, everybody. Welcome to what I'd like to call for the next couple of days, Lockdown with Jess. And sundry. No kidding. Whether you're 15 years old, whether you're 100, you'll be able to follow these workouts and burn some energy while you're at home. And I acknowledge, with a lockdown comes lots of eating, lazing about, barely getting in any exercise, and we understand that. But it's no reason for you to fall off your routine or gain weight. So I'm hoping that I can demonstrate a few exercises that would help you get through this lockdown session or period really easily. Now, to do the workouts today, because I'm just going to be sitting here or standing here looking pretty, I've recruited, of course, one of our very own broadcasters here at City TV. I'm talking about co-host of Breakfast Daily, Kweku David, who's also here with me this morning. So, KD, you ready? You ready to go? I mean, I know he's a fitness guy. He does his workouts. He gets his workouts in. So I'm going to be doing the demos. He's going to be working out. All right. And just try as much as possible to follow, everything that we're doing. So wish you the best of luck. I hope by this time you'd have grabbed, some comfortable clothing, some shoes, and maybe some bottles of water. Because I have dumbbells here, which I'll be using. Kweku David has bottles of water. He's filled it with sand, and that works. But if you have water in the bottles, that's fine. You don't have to necessarily find sand. It will still give you some kind of resistance and will help you through these workouts. So welcome once again. We'll do this real quick so everybody can follow, and we'll take it from there. So start the clock. We'll start with a warm-up. All right, Kweku. So because we're going to be working out every part of our bodies, it's important that we sort of bring some blood into our muscles, okay, to warm it up so we don't get any injuries. So to warm up my hands, the very simple things that I do, and the first one is to make sure that I stretch out my triceps. What do? I grab my hands like this, and then just to show you, turn around and make sure that your hand is touching the back of your shoulder blades, all right? Right there. Now, once you're done doing this, continue to stretch, all right? Now, to add some, more resistance, you can actually lean in the opposite direction of your hand that is up. Now, what you'll realize is you get a nice stretch over here, and that's being effective. After doing that, you bring your hands back down, and then you bring your left hand right back up and repeat the motion, all right? So you hold that here for a few seconds, and then you move it to the left. There you go. So you get a nice stretch. And you can go as far down as you can, all the way, or even up here, all right? But it's important that you get that nice stretch right there. So we're done stretching our triceps. Now you can also do this very easy workout. So it's like stretching your shoulder muscle right here, all the way. So just stretch your hands like that. Put your hand behind your elbow, stretch. You can let your hand hang loose or raise it up. It works. All right, then you change to the other hand and repeat the motion. Here we go. For a few seconds. Alrighty. Now what I also like to do is to stretch my quadriceps, which is a huge muscle in front of your thigh or your thigh muscle, and then my hamstrings. Let's start with the quadriceps. So what you want to do with the quads is essentially grab one toe. Now, there are different ways to do this. So let me explain. So you can either grab your foot like that, the tip of your toes like this, to give you a nice stretch, okay? Or alternatively, whilst we're doing this with the same hand, you can use the opposite hand to grab that. All right, so depending on which one you prefer, each of them are effective and they still give you that nice stretch. So what you want to be doing is, and you can keep stretching, what you want to be doing is, not only are you holding up your leg like that, make sure that your knees are close together. Not like this, but close together. Now you also want to push your waist out. Now if you do that effectively, you'll feel a stretch on the top of your thigh muscle, right here, in your quads, all right? Put your leg down, repeat the action on the other foot. Try to gain your balance. It's not always easy, okay? So like I said, you either cross hands or same hand holding same foot, all right? Stretch out and then put it back down. Now to sort of work out or to warm up your hamstrings, what you also want to do is a very simple workout. Kweku, let's turn to the side and demonstrate this. So you bring your right foot out, make sure that the heel of your foot is on the ground and your toes are pointing upwards. And then not everybody is flexible, but here you go. You can go as far down as you can. If you can reach here, that's great. If you can go even further to hold the bottom of your foot or your shoe, go ahead and do that. And hold for about 10 seconds. All right. And then change. So next foot, also out, hold. And we're good. All right. So now all your arms or your muscles in your arms, your feet are worked out. All right. So a couple of workouts, very easy to follow. I'm not sure where we should start with. Maybe with the dumbbells. Okay, very easy actions. So I like to do from time to time multiple workouts because I feel like you don't have a lot of time. You want to work out as many muscles as you can. So we can start with, instead of just doing a bicep curl like that, right? Bicep curl, you push up, bring it back down, and then back into the bicep curl. Okay, so here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We'll go to 12, 11, 12. There you go. All right. Now you can put this down and rest for 10 seconds. And feel free to do anything. Because we're practicing social distancing, he's not touching me, I'm not touching him. and that's the way we want to do it, okay? So if you're doing this with someone at home, you don't necessarily need any kind of contact, and you can still get your workouts in. So this exercise we did is good for your biceps, it's good for your triceps because you're pushing up the muscles over here, and of course your heart rate begins to rise, all right? Now there are other workouts that we can also try. Next one, for instance, can be my least favorite workout, called a burpee. I don't like burpees, but they're one of the most effective workouts you'll ever find. Now, let's move this to the side slightly and demonstrate. So burpees are very effective. If you're looking for a workout that will let your heart rate go really high, really fast, this is the workout for you. Now, how do you do it? Very simple. So let's face each other and give people like a side view thing, all right? So here we go. Now, you put your hands on the floor like that, okay? And then you push back. So you take both feet back, like that. And your back has to be flat. It shouldn't be like this or like this. Your back should, as much as possible, be flat, all right? Or straight back or flat back. And then when you're done, you kick yourself in like that, and then you jump up. That's one very effective workout, all right? So let's try this, okay? How many burpees are we doing? Maybe 12? All right. So you're gonna go to 12. I'm gonna go to 6. Here we go. All right, so let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. There we go. Now, if I was to look at my watch, I'm sure my heart rate will be all the way up. How does that feel? Yeah. Knocks the wind right out of you. All right. Now, once we're done with this, what we also want to do is something called a jumping jack. And that's very easy to follow. We do them in school. I do acknowledge that not everyone, right? So if you're someone who has knee problems, I'll do a modified version for you. Okay, you ready? So we'll do 12 of that as well. You ready? Let's go. So 1. So you do the actual jumping jack, yeah? Let's go. 6, 7, 9, 10, 11, 12. All right. 10 seconds rest. And your heart rate should be all the way up by now. All right. That's great. So that's another workout that you can easily do. Now we can go back for the weights. Just one of them this time. All right, just one of them this time. Okay. Now with this, here's our stance. I call it the thinking man position, all right? Like that, hand, your chin should be on your hand like that. Then you go like this, and you do a bicep curl. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now when you're done with this, you do a tricep curl as well. Here we go. Or tricep extension. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right? Now you can repeat this workout as many times as you want. So 10 minutes up already. That was pretty easy. Okay, so essentially you can do all these workouts we just did in succession. Once you're done with one set, rest for a minute and go right through it all the way from the beginning. And that's an easy workout to do when you're at home. Wish you the best of luck.
So that was Lockdown with Jess. And I hope one day I'll get the courage to try it. But how was the experience?
Oh, well, I mean, I'm someone who likes to stay fit, you know, and to keep fit. So it wasn't a tough experience for me. However, I want us to sort of look through the different things that we did and explain why it's important to do those things, you know. So at the very beginning, we had the stretch, you know, the basic stretch.
Which is what you did.
So yes, there was that. Okay, so you stretch basically your upper body. Okay, so your arms, first of all. Now, if we did a more detailed stretch, we would even do things like stretching your neck. And all that, because it's important. You see.
Why are you stretching before you work out? Because I just woke up. Why do I
exactly?
Need to stretch?
So what happens is that there's a lot of compaction and compression, okay, of bones and muscle when you are sedentary, right? Either you're sleeping or you're sitting for a long time. This is what happens now. So in order to activate your muscles and then also to give the bones, you know, the alignment that they should have, the appropriate alignment. You need to stretch them out. So if you think of like a creased outfit, like a cloak, you know, a dress or a suit that's creased, right? If you hang it out for long enough, a lot of clothing without ironing will actually straighten out, you know, and that's basically what you're trying to do with your body. You see, so make sure that
because you've been lying still for so long.
You've been lying still for hours. You know, and then sometimes too, maybe people even work out would spend they'll do the workout maybe every 48 hours, right? So in between workouts,
you can stretch.
You still need to do a stretch.
Why do they start with the upper body?
Well, I think it's a matter of preference. I think that's a matter of preference. It's the upper body has smaller muscles and smaller bones. Okay, so it's easier to start from there. Okay, think about it like this: stretch every bit of your body out. So your hands, your arms, you know, the muscles around your arms, for example, are much smaller. Then when you're done with the upper body, you go down to the lower body. Now, what she's doing there, what Jess is doing there, right there, is a stretching of what we call the quadriceps, which is the muscle in front of your thigh. Okay, so that big muscle, that's the biggest muscle body. That
muscle in your body. Okay, wow.
Okay, the largest group of muscles in your body is the quadriceps.
Okay. Does it also touch your knee? Because I know you're bending.
Well, the quadriceps is actually attached to the knee. But there's a group of muscles inside the knee. They are much smaller. Ligaments and muscles inside the knee itself. And then below that, you also have your calves with, you know, your calf muscles attached as well. So all your entire body needs to be stretched out in bits. You know, so what we're doing here is the warm-up is to actually warm up the muscle before you start putting a lot of pressure on it. If you don't do that, all right, what you're going to have is a situation where something that is cold, you put a sudden stretch on something that is cold, it can snap.
Yes.
You know, so what we're doing is that you warm up the muscle, you warm up the ligaments, and so on, and it allows the body to function properly, right? To function properly whilst you're doing.
And what I really liked about the Lockdown with Jess is the fact that you had, what did you use?
Yeah, so
for the.
So Jess came with her dumbbells, right? But then what we wanted for viewers to also experience is that you can actually make your own dumbbells at home, right? If you have some sand, dirt, you know, in the backyard, you can always go out, take a water bottle and fill it, an empty water bottle and fill it. Or if you don't have sand in your yard, just use water in a bottle, okay? Fill it, an empty bottle with water, and you'll have a dumbbell ready to go.
Yeah, I like that because a lot of people, you know, beginning of the year, new year, new me, gonna work out, gonna live healthy. Then you're like, work, this. You make all the excuses in the world. I have a very good friend called Paco. Both he and I have making excuses why we are not working out. But now you are home for 2 weeks. You're doing absolutely nothing. If you don't take advantage of it now, that means the problem is not the years, it's your willpower. Because you have no excuse. You're taking the kids to school, you are not going to work, you are home, and you're stuffing your face with bread and eggs as you are watching me, and you're not burning any fat. So take advantage. I'm going to do it when I get home myself.
Yeah, so later after the stretch, then we got into the workout. Now the whole idea of working out is this: you need your heart rate to pump at a certain speed. It's like you're giving your heart a workout, right? Now, when you do that, and you do that regularly, get your heart to pump up to about 180 beats per second. Sorry, per minute. Sorry, not per second. You'll be dead by then, right? Per second, you'll be dead.
No, we're not talking about no death jokes, guys.
so when you get your heart rate beating that fast, what happens now? When you are sedentary and you come back to your regular time, your body actually functions a lot better. Okay, so you find that you have more energy, you have more oxygen supply
because you're pumping.
Because your heart is pumping better, which means that it's all the bad air or bad gas in your blood. So carbon dioxide, carbon monoxide, and all of that will pump quicker to your heart, and the heart will also redistribute and pump fresh oxygenated blood quicker into the rest of your body.
Organs will be happy because
your body will thank you. Now the key thing to remember is that when you start this workout with us, if you've not been working out for some time, your body will be sore. You don't have a choice. Your body will become sore. But there's good news. It's sore because your body is not used to all the toxins that are being released as a result of the sudden exercise that you're introducing, right? There's a lot of toxins, there's a lot of breakdown of muscle. All of these are contributing to the pain in the rest of your body that you're experiencing when you start this workout. Now, usually in the first 24 hours, you won't feel any pain. It will usually start after that. And you begin to feel that, ooh, my thigh, my legs, my this, my arms, my body is hurting. Now, the key is don't stop the exercise, okay? You may want to even take a step back a little bit. So instead of doing 20, you do 10, right? But don't stop the exercise. If you stop the exercise, all the gains that you make will be lost. So don't stop the exercise. What you do is to go through the pain. Keep exercising through the pain. All right, and then if you do that, give yourself 3 days, maximum 5 days after that, all the pain will be gone and you will be coasting and sailing, and it will just be a blast. All right, so that's something to remember.
And it's difficult, okay, especially for the newbies, because you'll feel this sharp pain here at some point, then you're getting dizzy, then you're asking yourself, why am I doing this to myself? I could be in my couch chilling. But your body will be happy. Now, yesterday I saw a man. Actually, he's not supposed to be outside jogging, but he was outside jogging,
I see him every morning,
he was holding a can of soda to just quench the thirst from the workout.
Yeah, defeats the purpose.
Is that something you should be doing?
Absolutely not. Absolutely not. Your body,
go to the kitchen and
needs fresh water, fresh, clean, distilled water. If you can have that, get that. If you can't have that, regular good water is good enough, okay? It's absolutely important. Now, we can't overemphasize this. Water, water, water. Keep hydrated. You will see that in subsequent episodes. We'll just keep you, reminding you. It's so important. Keep hydrated all the time. Now, water does a number of magical things to us, right? First of all, it aids digestion. Secondly, in terms of even your body function, so we since this whole COVID-19 business started, right, we've been told. So if you're not hydrating, you're doing kind of you're losing a lot of water when you're working out. That's not the time to be taking concentrated substrates, in drinks into your body. Okay, you're going to harm yourself if you do that.
Definitely.
Okay.
And the reason why we're bringing you all of this is because a lot of you guys actually reached out to us. Remember, Earlier this week, we asked you that how can we make our content more interactive as you're home? What are the kinds of things you would want to see? And a lot of you sent us messages that, listen, guys, I'm home and I've been wanting to go to the gym forever. I don't know how to start. I don't know where to start. I don't even have the material. And I don't have an instructor to come to my house because we're saying everybody should stay home. So the team met and we're like, okay, the best way we can do this is, hey, Jess is there. We've been doing transformation with Jess all this while. Why not do lockdown with Jess, right? So we're going to be bringing you some of these videos so that you can practice at home yourself, stay healthy, because one of the big facts and factors actually in beating COVID-19 is actually having a healthy immunity. So beyond the workout, we'll also be bringing you videos of cooking healthy meals, right? So that as you're home, you're not stuffing your face with carbs upon carbs upon carb, and then by the time you're done with 2 weeks, you've gained 50 pounds. That's what we don't want to happen. And so if you have any other things you would want us to show you, just let us know, right? And we may just bring it to you because we're here to bring you relevant content. So just use the hashtag Breakfast Daily or WhatsApp us at 0550-585-832 and let us know what you would like to learn about while you're home. And if you're outside Ghana and you still want to learn something, just use the country code +233 and we'll be sure to do that for you.
Yeah. So we have some music as well for you this morning. We want you to enjoy something from Santrophy. Let's take a look at this.
And that was Sun Trophy, long before we all had to practice social distancing, courtesy COVID-19. Can't wait to get back to our
We have so many amazing recordings of different acts and artists, and you know, as time goes on during this season, we'll be playing a lot of them back for you, so you can enjoy some of the great moments that we had in studio here with them. Yeah.
We're still covering the fumigation, disinfection, exercise in the northern region. So we'll be updating you as we go on. I mean, all the markets are empty. People stayed home. It seems as though everyone is listening and complying. So we have some of our colleagues covering it, and they'll be updating us on what's going on so far. Halabira is actually there, one of our colleagues. He's there, and he's going to tell us what he's observing so far. Good morning.
Good morning.
How are you?
I'm doing well.
Good, good, good. Where are you right now? How long have you been there, and what's the energy like?
The energy is not. There's no energy again. I'm currently still in Yendi.
Okay.
And Yendi in the northern region.
Okay.
Currently, the fumigation exercise has started. They have gone into the market and spraying the main street. Yes, Yendi people. Happening, what is actually happening on the street. People, instead of staying at home, they are rather out, coming, especially children, they are coming out to see what is going on when they have been advised to stay at home. And the breathing in the chemicals is so dangerous to their health. Again, people are traveling in. They have currently, as I speak with you, in front of me, there is a bus and passengers are there. They are just moving without nose masks and other things, so which is dangerous and very worrying.
Approximately how many people? Because we know that in Tema we had some bystanders, we had some in Accra. Kumasi didn't have a lot of this problem because they had a van actually telling people what's going on. But how many people are you seeing outside trying to see what's going on?
There are many. There are many. People people in town. Some are riding motorbikes, others on bicycles, and small children who are there. But I mean, the passengers that are coming in, my interaction with them, some say they don't know about the exercise, so they are just taking a back in town here. They are now seeing it for the first time.
Okay. What are the authorities doing about this? Because we've been told that the things that they are spraying are actually not harmful, but are the authorities engaging them and educating them so that they will know what's happening and go back to their homes?
Yes, the municipal chief executive for Yendi has told in my interaction or interview with him, said he has given directive to the barriers into Yendi town that they should talk to the passengers that are coming in to either stay there for the exercise to complete, or when they come in, like they should be sensitized before they come in. And that, please, seriously speaking, myself, I am worried for them because they have nose masks and other things, and they are just there. Some are just roaming, carrying their bags on the street, and it's a worrying situation, please.
So, do you have any detachment of security personnel, soldiers or police, with the team as they've come to spray?
Yes, the military, police, and then the fire service, they are all here to support the exercise. Some of them have moved into, I said military, fire service, and then the police, they are in to support the exercise.
Okay. Okay, yeah. and are they not able to fend the people off and send them away?
Yeah, initially I saw some military, the policemen, they were trying to scare them. But this time I was interacting with them, and they say, for now, what can they do? Because they don't want to use force, train them to do, because if they do that, we ourselves will report section. I said no. They should rather, their health is more important to us.
All right. Okay, thank you very much, Aminu Alabira. He's been speaking to us from Yendi.
Yes.
Yeah.
Thank you so much, Mohammed. And again, human beings are curious. We're all curious. If you see something's happening in your neighborhood, you're probably going to go there and watch, right? But I think that the agencies are actually the ones who should be proactively engaging them. We saw Kumasi execute this in a very great way. They had a car actually announcing to people, this is what we are doing. So you have no business coming near us. So I think this is an experience that the other regions would have to also learn from. Now, our colleague, Diane, if you're curious about anything at all and you want us to ask our correspondents for you, let us know with the hashtag Breakfast Daily and the WhatsApp line 0550585832, and we'll do well to ask them on your behalf. If you're outside Ghana, don't forget that the country code is +233.
You know, the difficulty that Alabira just mentioned, I think it's actually, I can understand you know, why that challenge will be happening, because if you notice that every time you're doing something in a place that they've not seen it before, right? Here are all these people. Can you imagine? Here are all these people coming to town looking like Terminators, right? Wearing green overalls with you know, backpacks and you know, coming to spray and all that. It's
like an action movie.
Yeah, you know. So it's not something that you see every day. You know, which I think also it's important for us to not make this a 9-day wonder, because by the time you've gone back the second time, third time, they will now be used to it. It's like, oh, we know what they're doing. Let them do their thing, and let's also mind our own business. You know, so yes, I can understand what's going on there. I also found, so yeah, I mean, I think that we should keep this exercise up, and we do have our colleague Dinah Ingwan also on the line. Dinah.
Yeah.
Good morning again, and how is the disinfection exercise taking place now?
Are you still in Yendi?
No, I'm in Tamale.
Oh, you're in Tamale. Okay, what's going on in Tamale?
So the team is at the Lamashegu market where the disinfection is ongoing, and here too the market women have complied because they have closed all their shops and covered all their goods here. And so there's no much challenge here in the market.
Do you see any people standing by trying to figure out what's going on? People just, you know, driving in from neighboring towns to see the action?
So, before they had announced in the radios here, the local stations here, to tell everybody this is what is going to happen. So they are all alert and waiting to see how the exercise will take place. So there are people around just observing what is going on here.
Are the authorities engaging these people to perhaps maybe go back home, or they are just leaving them to just watch what's going on?
I didn't get that.
Are the authorities engaging them to go back home, or they are not bothered by them? They are still going on with their exercise?
No. They are not. It's not as though they are. They came from somewhere. No, there are houses around the market. And the street. So they are out their homes to see what is going on, and they will go inside when the team have left here.
Okay, but so far, what's your personal...
the shops are closed here, and you don't see much movement in town. I'm not even seeing people going to work. The banks are closed. Most offices here in the metropolis are closed, and there's not much activity just because of this exercise. So, all in all, I'll say it's okay.
Perfect. Thank you so much, Diana Ngong, for that update. She's at